Has a Bachelor of Education and a Master degree in Counseling Psychology. She's a registered clinical counselor with the BC Association of Clinic Counselors. She has provided individual, couple, and family and group counseling, specifically to cancer patients and their families with BC Cancer Patient and Family Counseling for 7 years, and more recently also with the Prostate Cancer Supportive Care Program, in which we were able to access her and have her do a presentation today. She's done group counseling, has included facilitating adult patient support groups, as well as relaxation and wellness groups. He has more than 20 years prior experience in leadership, consulting, and teaching. She has an active interest in education, research initiatives that improve the experience and support of patients and their families. Without further ado, please welcome Monica Hugh.
Thank you, Bob. And thank you, everybody. It is a pleasure to be here and to hopefully talk about things that you'll find helpful. So I don't know if the host can help me, allow me to share my screen. Oh, looks like I already can. Just to reiterate that I think with the setup we have today, that when you have questions, maybe you can either put them in the chat and Rochelle will moderate, but mostly, unless she feels it's really appropriate, she'll let me know in the moment, but otherwise we'll save it for the end. Okay, so here we go. Okay. Oh, so I have to go back. All right. So I was told that anxiety and depression were some of the key areas of interest for today. But at the end, obviously these things overlap and other things are involved. I did hear, I don't know, we didn't go into a lot of detail, but I did hear a question about PTSD. So but they all overlap. And so we'll just go forward. I just have a few words. One is just how important it is to realize that general information, so like when I give a talk like this, it's general. And so please don't anyone take anything I'm saying as specific to you or your situation, because things can be very individual. And individual counseling is very different from some of the things I'm going to say today, but I hope to give you some tools, strategies, just maybe some understanding about your own situation and things that'll hopefully be helpful. And even these strategies that I'm going to talk about today, it would really vary on each individual experience, your situation, the question of medications or trauma history. So again, just a real caveat to not take things too literally or black and white. And then again, at the end, we'll have some question and answer. So one of the, years and years ago, I read about a very simplistic, but very logical, and it just hit home to me, a model for mental disabilities or mental challenges, mental health, and it's called the stress vulnerability model. And put most simply, some of us have certain vulnerabilities already that we bring into a situation, whether that's just your current health situation or history with mental health already, or other challenges, could be financial, social, but we all have different levels and types of vulnerability. And then we have different stresses. And if we, at a certain point, our ability to absorb those extra stresses will, create impacts or maybe even overwhelm our resilience. And so in that model, Later on, I'm going to be talking about sort of intermediate or immediate interventions, and then I'm going to talk about practices. And the difference is that practices help build the usual resilience and build up or reduce our overall vulnerability. So when I talk about stressors now, the impact on them will vary from person to person. So receiving a prostate cancer diagnosis it will have an impact for sure, but it could be a very significant impact on self-identity, whether it's the diagnosis or erectile dysfunction or incontinence or the results of androgen deprivation therapy. Those all have different impacts and definitely do have impacts. Then there's impacts on stress management. If you're not able to do the same types of activities and exercise and so on, then that impacts your resilience. So again, the impact on activities, and right now with COVID, of course, that's even greater in terms of restrictions on the things we did that were stress relievers and opportunities to decompress. Then there's impact on our interactions with our partner. Some people say that prostate cancer is a couple's disease because it really affects your relationship in ways that other cancers may not. Now, of course, anytime one half of a couple is facing cancer, there's always impact on the other partner for sure. But there are obviously differences with prostate cancer. And then relational patterns may be exacerbated. It can create a real both challenge and opportunity for working on communication and the types of communication skills that maybe we haven't learned some, or maybe we have certain habits that are less helpful now than usual, but that's another area of stress. So these all can create conflict, relational tension, distance, and exacerbate anxiety or depression, or have new anxiety or depression. Okay. I really like this quote because it sort of relates to how our personal experience of this. Now, when I use the words suppression and avoidance, actually they're sort of trauma related, but again, all these things overlap. So let's say I have a fear of recurrence or a fear of a particular challenge or issue coming up. I will mentally react to that somehow. And there are helpful ways and less helpful ways. And it's not all black and white because, for example, sometimes distraction is really helpful, but it's not great if it's our only tool and we use it exclusively, So suppression is when we suppress the full experience of something that's difficult, and a typical trauma is an example of that because we suppress the full impact because it's too overwhelming. One of the definitions of trauma is a situation that is more than we can handle in the moment. Our resources are overwhelmed. So you might have heard stories where people might suppress the memory of something altogether, or so there's different levels and types of suppression. And then there's avoidance where, we don't want to think about it because again, we don't feel fully resourced to face it head on. And so we sort of avoid it. But this quote, and it's a little bit cut off on my screen. So it is as if the mind recognizes the extent of our resistance and in response interprets it as further evidence of peril. And this is really important because as we work with ourselves and realize that, and get an accurate understanding and appreciation of the facts versus our fears. And it's not that simple, but that's just how I'm going to leave it for now. There's the fact that I was diagnosed with something and I needed treatment, and it had this, these are already things that have happened. And then the fears are things that I'm afraid will either continue or get worse or happen in the future. And the size of those fears creates resistance, which is involved in all of these mental health issues. But when we recognize that the extent of my resistance, and then our minds, it's like they think, wow, if I'm so resistant about it, that means it must be true. And that means I really am in that much danger. And it sort of can spiral. And Peter Levine, by the way, is an author that writes a lot about trauma therapy. So, and he has books that are in the public library as well. Oh, okay. So anxiety it's important to realize that fear is the emotional response to a real or perceived imminent threat, whereas anxiety is anticipation of a future threat. Okay, so fear is a very helpful response. Its purpose is to make us more alert. If I'm about to walk out onto a busy traffic, and maybe I'm not paying attention, and all of a sudden a car brushes by me very closely, and all of a sudden I'm afraid. Well, I'm supposed to be more alert right now, and so that's helping me deal with an immediate, imminent situation. Anxiety is about the future. It's not happening right this moment. It might be based on things that are happening or related to things that are happening this moment, but it's about tomorrow, next month, next year. Okay. And the critical difference there is that other than being responsible with planning and dealing with things, one of the areas of the biggest problem is that we can't actually do something about the what ifs, because if you worry about building a house and you're worried about it being catching on fire, of course you can say, what if it catches on fire, and use inflammable materials and build in a responsible way. But what I mean by can't do anything about it is that we can't eliminate all possibilities of threat, because we don't even know which ones are ever going to happen. And so anxiety is highly related to that need to deal with and minimize or eliminate the possibility of future threat. And it has a lot to do with our sense of resilience. So significant personal loss or life change are frequent factors that precipitate anxiety and panic. And so the third bullet here, the dynamic roles of vulnerability and confidence. The more vulnerable we feel, the more we will have a high need for security. And so, and things can get out of balance. And some of the tools we're going to talk about have to do with rebuilding confidence. And what do we build it in? Okay. Whoops, I keep going the wrong way. Sorry about that. Okay, so this, and I have a few graphics in this presentation that are very hand done, so my apologies for that. But this graph represents the 0 to 10 represents, very low stress or no stress, and 10 is very high stress or panic, anxiety. Okay, so at the upper bracket, that's when you want to use interventions in the moment that are, if you're having a panic spike, some of the tools I'm going to talk about are when you're in that, dynamic of things getting really spiking. And then the other bracket is practices, so things that you would do regularly, no matter how you feel. Okay, so this is for the acute phase interventions. Just for sake of time, I'm not going to go through them all thoroughly, but you can let me know at the end what you're interested in. But I'll pop to the second and third one first. Grounding is a word that, you know, there can be other words for it, but it's the sense of collecting yourself and restabilizing yourself. And it has a lot to do with the first one, which is getting your consciousness, your awareness into the present moment. And this is where it relates to the third one as well, because you want to be able to assess whether in the present moment you're actually okay or safe. And I use the word okay enough and safe enough because, you know, we could all argue about what's the definition of okay. And you might say, well, I am not okay, you know, I don't feel okay. But okay or safe enough have very much to do with, is there anything acute going on right now that would make you not okay? You know, this is really extreme, but you know, if the building was on fire, or if there were bombs going off, or if you were profusely bleeding, those would all be clear indications that right this minute something has to change, you need attention, something has to happen. But other than those acute things happening, you want to be able to connect with the fact that if life never got worse than just this second, you'd be okay. You'd be able to tolerate it. And grounding yourself in that consciousness, and it's important that this isn't an intellectual assessment, but that you can connect in just your sense of your awareness of your whole being, your body, that you're okay just in this moment. And you're not asked to assess whether you're going to be fine in 10 minutes or an hour or next week or next year, but just now. And these, all these different interventions are meant to help bring you back to a regulated place where you are resourced. And these would be ways to do that. Practices for anxiety involve things like breathing practices, which regulate your autonomic nervous system. We could talk for some time about those things, but regulate, you know, on one side, your nervous system, if it was on a continuum, you know, you've got your fight or flight response. And a lot of times, well, panic and anxiety are definitely when our bodies are going in that direction, because they're gearing up for a threat. With anxiety, the threat is next week or month, or, you know, and so it's not helpful for your body to be in that state for long periods of time. And it is helpful for our body to be able to be in all these variated places depending on the situation. But usually we don't need any help getting ramped up. So often the intervention is on helping us restore regulation and calming ourselves. And breathing is a very powerful tool to do that. Exercise is shown in research, and also it's just logical that having exercise is really good for depression, anxiety, stress, all these things. Relaxation, I'm putting separate from breathing practices because you can use other methods as well. Music, movement, dance, so many different ways, but all ways to facilitate allowing our body to support a mental state that we want to reach. Mindfulness is just huge. It started, I think, in about the 70s in North America with Jon Kabat-Zinn. And it is, it's related to meditation. It's it's highly recommended. It teaches us so many things, one of which is that we experience the fact that thoughts and feelings are just thoughts and feelings. And we realize that we remain. And one analogy there is, if you picture yourself as a mountain, the mountain is always there, but it could be, there could be an incredible storm going on. It could be blizzarding and could be very cold, and it could be tumultuous. But then another time it could be bright and sunny. And so you are like the mountain, that you're always there, and your thoughts and feelings, they come and go. And experiencing that distinction, that differentiation is a very helpful, so to speak, muscle to build to deal with these types of things. Dealing with feelings, this is also sort of a big category because it's so much variety, but in essence, in some ways, we learn to have a more productive relationship with our feelings. We learn to understand their purpose and how they work for us and our own history with feelings. We learn to tolerate feelings and, just develop a more helpful relationship with them and actually appreciate them, because they're one of the joys of being human. And, if we were all robots, we wouldn't have any, but life would be very different. Dealing with unhelpful self-talk or mistaken beliefs is really basically, we could say that's cognitive behavioral therapy, because some of us have mental patterns that are really unhelpful and can get exacerbated in different situations. And how we recognize what they are sometimes is easy for people, and sometimes it requires a little bit of work. But one example here would be all or nothing thinking, and it's really important to know that these, you could be an extremely intelligent person and still struggle with some of these things just because of the way as a human we're wired. So let's say you tend to have catastrophized thinking. If this goes wrong, then for sure that will go wrong, and that will go, and I have to solve for the worst case scenario before I can allow myself to feel okay. Has nothing to do with intellectual competence. Some of these things are just challenges that we have, but that we can work with. And then connecting to inner and outer resources, which it would put most simply, the inner resources are my capacities, my ability to calm myself, to regulate myself, my ability to, all these different internal things. Outer resources could be speaking to a counselor, or talking to your friend, or somebody supportive, or accessing services. Okay, so I'll just take a breath. All of these overlap, but that was mostly about anxiety. When we talk about depression, it's important to realize that depression and grief are not the same thing, though they share feelings. You might feel sad, you might feel unenergetic, but they're not the same thing. And the same depression and adjustment is also not the same thing. And so third bullet, sad, empty, hopeless, discouraged, or irritable mood with somatic and cognitive changes that affect our capacity to function, loss of interest, pleasure. Those are descriptions of depression. But again, grief and adjustment issues and depression overlap. So the importance there is to realize that grieving and adjusting are healthy. Those are processes that we might have to face, not by our choice, but the processes, even though they involve some of these feelings, the processes are healthy. But clinical depression is different. Okay, I'm going to skip this analogy because of time. Or maybe I'll do this one. Okay. Because this relates to a lot of things. And again, sorry for my graphics. So this is a bucket and there is a water level. It's holding water, and the line there shows how much water is in the bucket. And if we oversimplify our lives and say that our one task is to maintain a decent water level as much as we can, then that provides an analogy for why we do and some of the things that I'm talking about, and also having sort of an overarching purpose to some of these things. So in life, oh, sorry, I forgot to mention that the water level represents our life force, our energy, our, our life force. I'll just say it that way. So life gives us holes in the bucket at times or regularly. But the problem is if we have too many at the same time, because the water level will just go down too quickly. So we can have different options. Sometimes we might be able to plug up a hole entirely and stop the water leaving that way. Sometimes we can make a hole smaller, and sometimes we can't get rid of the hole at all. That's just the way it is, right? We have ongoing challenges. So what are our other options? Our other options are, well, what are the things that add to us in anyway, in life? Where do we receive life and energy? And here again, one of the issues is sometimes when we face a new challenge, say a cancer diagnosis or something, some of our common inputs are now not possible. Let's say we have to stop work for a while, or we can't do our favorite exercise for a while. And so some of these things aren't possible. So that's actually theoretically the worst case scenario, that we have more holes and our inputs are now not possible. So when we find ourselves in these situations, and this is a simplistic version of what's happening when we have a new health issue and there's all kinds of unknowns and all kinds of extra stresses, and then there's less capacity or opportunity for the life-giving inputs, we find the water level going down. And that dynamic itself can cause or exacerbate anxiety and depression, because inherently that your resilience is like just draining much faster than you've maybe ever experienced, or certainly that you're comfortable with. And so that can just by itself heighten these things. So knowing that can help you make sense of how you're feeling. Okay. So then, so one of the keys here would be to identify and work hard to identify other inputs and be creative. And, sometimes I hear people say, well, just doing X or Y won't solve my problem. Going for a walk or talking to my friends is not going to make my cancer go away. No, it won't, but it will contribute to your water level and your resilience. And so this is why we do these things. Okay. So awareness for depression or interventions, awareness is really key, because one of the issues often with depression is we can sometimes shut down to varying degrees, and we don't have the perspective on what's happening for us. It's almost like, say an alcoholic not admitting that they have a problem. So awareness is key to then becoming willing to doing some of the things. The second intervention here is I often give people the task of creating a list of 20 things that might put water in their bucket, so to speak. And again, we don't have time right now to really elaborate on that, but it's why. And also the 20 things need to be things that you enjoy and can bring you into a different state of mind, because working with depression, it's not as helpful, or maybe helpful, effective, to try and convince ourselves that we're wrong. Let's say I feel like I'm never going to be happy again, or something like that. I can't argue with myself effectively, because it's possible. It is possible, but whether it's likely or not is so subjective. And so when we're in a depressed state, it's not the ideal state to have this discussion with yourself. And so the purpose of the list of 20 things is giving yourselves opportunities to get yourself in a different state of mind. And I could go on about how that works. But when we're in a different state of mind, we'll be more receptive to a different perspective. Another possible intervention for depression is intentionally accessing positive memories. And this again has to do with state of mind and how those work. Practices for depression, again, cognitive behavioral therapy, dealing with unhelpful self-talk or mistaken beliefs, just really understanding what your patterns are and learning to watch out for them and work with them, change them. Again, grounding and working with your autonomic nervous system. This is a little more tricky, because sometimes in a depressed state, you could feel completely unenergetic, but it's actually a collision of your sympathetic nervous system and your parasympathetic nervous system, sort of both operating at the same time, putting you in sort of a conflict that feels like you're kind of frozen. But anyway, working with your autonomic nervous system, and getting unstuck and regaining that flexibility is a good thing. For depression, there is really social engagement is huge, because again, it gets us out of ourselves and puts us in a different state of mind. And even if you have an annoying conversation with someone, believe it or not, just being out of that stuck place in different ways can be really helpful. Exercise is always helpful. Mindfulness, meditation, centering, embodied practices is helpful for, just like exercise, some of these things are helpful for all of us all the time, no matter what, but particularly in these. And then again, awareness of and relationship with emotions and understanding them and learning to work with them. Okay, so awareness creates choice. So this is critical because of the role of our unconscious. And a lot of times we feel all these feelings and we're experiencing, maybe frustration or depression or lack of energy or heightened anxiety, but we don't really have an awareness at another level of what's happening. And when we do, that creates choice. And then this is almost like a mantra for me, but the attitude with which we work with ourselves and others is critical. The way you do anything is, the quality of it is critical to its outcome. If you force yourself to jog with someone running behind you with a whip, yes, you might have some cardiovascular exercise, but it's probably not going to have a long-term beneficial, it's not going to have the results you probably want long-term. So kindness is an attitude that if you can develop that for yourself, it's phenomenal how hard we are on ourselves, so much more than we would be to a friend or a brother or, you know, a neighbor. When you really slow down and realize how you're talking to yourself and how you're dealing with yourself. And, you know, often it's, well, if I don't pull myself up by my bootstraps, nobody will. And, you know, I'm not, we have to learn to differentiate between self-motivation and the attitude and environment with which we do it. So kindness is critical, and there's a lot going on in the psychology world about self-compassion, and a lot of research on how those things have much better outcomes in the end, and history about why we've developed, you know, these different attitudes of driving ourselves. And I don't mean to not have goals and all those things, but okay. And the other one is curiosity. And so when I'm curious about what's happening for myself, or, you know, what's happening in my relationship, or the reactions I'm having, and I'm suspending judgment, it just opens things up to much more creative responses. And so kindness and curiosity are just really helpful things. And the opposites would be, you know, self-judgment and fear-based actions, motivations. Yeah. So I think that brings us to the end of this. And so I'd like to open it up for questions, comments, discussion. And I'll stop sharing the screen so that we can see each other some more. If I can find my mouse. There we go.